So I'm here with Dr. Liz Lipsky, who's a doctor of nutrition, clinical nutrition, and I have Dr. Jane Giltonen, who is a naturopathic doctor, and I have Dr. Tierna Lodog, who is a medical doctor and herbalist. And we are going to give you guys some wisdom from these fine doctors. Do you discuss the importance of community with your patients?
I do. I think in terms of support and strategies, community and a like-minded community, or a community of people who are struggling or searching or seeking or working on the same issue, can be extremely important for people. So when we go over a treatment plan, I talk about resources, community resources, support groups, meetings, other people, patients I might have who are willing to talk with my patient who has, say, PCOS or some other condition. It, I think, can be a very, very strong support system that will help the patient get where they want to go and help them feel like they're not the only ones that are struggling with this. So in that regard, I talk about community with people.
Great. Dr. Lipsky?
I think it really depends on the person and whether it's an appropriate conversation to have. Certainly if it's something that's important, then that would be a really important conversation to have. I'm just trying to think of kind of different opportunities. Definitely support groups. I've run lots of support groups. I think they're really important. I think family is really important. Friends are really important. People who are engaged in your success are really important to bring into your healing, no matter what that is. We're all in some stage of healing. And so I think it's really important, but I wouldn't say that it's always the topic of conversation.
Okay. Dr. Lodog?
I would agree. I think you learn a lot about their community by the way you ask the questions, especially during your interview. Tell me about your tribe. Tell me about your family. You know, instead of how many children do you have, or, you know, it's like asking them a more broad question that allows for them to share with you sort of, and that tribe word, actually a lot of people kind of resonate with that, because it could be their church, it could be their sports team, it could be, I mean, PTA, whatever, but people begin to describe that. But I would have to say that I think it to me, asking about their perception of community is different than also recommending resources, because we use a lot of community resources. I think those are very powerful. But how we define our community and how we self-define that, I think is very insightful. Social isolation, people that feel very socially isolated, it's more predictive of them having heart attacks and heart disease and depression than being obese, being an alcoholic, smoking 3/4 of a pack of cigarettes, and twice as deadly as being obese. So that community piece and how connected they are to their tribe is a very powerful question. I do use one quick tool. I do say, we don't have any bad news today. Everything's good today. But you know, there may come a point where maybe I have to deliver bad news. And I was wondering if you could just give me the first name of 4 people who would, you know, just drop everything to come and be here with you. And you know, some people like rattle it off, Richard and Viv and Mike and Scott and Jackie. I mean, they just, yeah. And other people, they just stop and they may say something like, maybe my daughter, you know, she might be able to come if she could get somebody to take care of the kids. You know, she could maybe, and that's the totality of it, and that's really for me very insightful. More than asking about community is asking around her support and her social network, because the one who could rattle off a million names, I know they've got social network. The person who's not even sure if her daughter could find time to come with her, I'm deeply worried about her spiritual connection and her network, and I might be working harder on community with her. So.
Great, good, thank you so much.